Hi everybody, welcome to week 7 of your research course. Congratulations, you are going to make it. You know, some of you thought maybe last week with all that ANOVA and COVA stuff that it was maybe iffy, but you're going to be fine. So this week we're back to more non-numerical, non-statistic topics. So implications and recommendations included with a research article. This is something that every author or researcher needs to include so that we can know a little more information about how we're supposed to use the data that was found, maybe looking for possible research opportunities on the same topic. So what I need you to do is look at those two terms and see how they're used and what should really be included in both of them. And you'll find that depending on who you talk to, it's maybe not always so clear cut which is which. Then we've got limitations. We have definitely learned that no matter how hard you try, there will always be some limitation. Think about when we talked about type 1 and type 2 errors. The things that you do to improve one area will impact another area. So there always are going to be limitations. And you really need to know about those as the reader so that you can help determine whether that limitation is going to be an issue for you if you wanted to implement something from that research. Okay, so we'll have a good discussion about that. All right, so this week we're back to our group assignments, and you're going to be submitting kind of the culmination of the work that you're doing on the evidence-based practice paper. Okay, so you're going to be doing the whole overview, starting with your final foreground question, your problem statement, kind of going through that whole process. And then the new pieces that you're going to be adding are the clinical guidelines and the implementation. So the clinical guidelines, exactly what do you want the staff to do to implement this practice? Do you want them to perform a certain assessment, to implement a certain skill? What are the actual clinical guidelines? Okay. Then, how are you going to make it happen to bring this to fruition? Is there going to be education needed? Do you need to develop any new documentation? Do supplies need to be obtained? And then, how are you going to know whether this worked or not? What are the outcomes that you're going to look at to see if the same thing happened in your facility that happened in the research articles that you looked at as your backup for implementing this plan? So those are the things that you're going to be looking at. So you do want to make sure to include the timeline and then also barriers and drivers. So what things are going to be problematic if you were to try to implement this EBP, and what things or resources at the facility do you think would help you to get things going? People, money, whatever at the facility that would help to get the project to move along. Okay? All right, so that's the general idea. Please let me know if you have any questions. And then in the last week for the DQ, you're actually going to be posting your projects, and we're going to be discussing them as one of the DQ questions. It's going to be a little tricky about counting who gets to post that, who gets the DQ credit, so I will be posting that next week so you'll have a clear idea how to do that. Everybody's going to get DQ credit, you're just going to do it a little bit differently, so no worries that way. Okay, everybody, I think that's about it for this week. We are winding up, and I am so proud of you for persevering. You all have really done a great job. I'll see you in the main forum.